Hello, everyone, and welcome to Best Practices for Creating NCLEX Item Types and Case Studies. My name is Christi Doherty. I'm the Executive Director of Nursing and iHuman Patients Academic Simulations, and I'm here with my colleague, Don Whitfield, one of our lead nurse consultants. I want to tell you about the very first NCLEX styles question that I ever wrote. Now, it was a disaster. I was fresh out of clinical practice. I was full of enthusiasm, and I thought I had written a question that would challenge even the sharpest minds. But when I tested it with colleagues, one person picked option A, another picked B, and someone else argued for C. And one brave soul asked, "Is this even testing anything?" That moment was humbling, but it also lit a fire. I realized that writing a really good NCLEX question isn't just about what you know, it's about how you guide the learner to think, to judge, and ultimately to make safe and effective decisions for patient care. And that's what we're here to talk to you about today. Over the next hour, we'll explore the art and science behind creating high-quality NCLEX items and case studies. We'll cover the common pitfalls, the must-have best practices, and how to write with the clinical judgment measurement model in mind without losing your mind. Before we dive into the details, let's take a moment to ground ourselves in what we already know about the NCLEX and how it's evolved. There are three core elements that have shaped the design and direction of the NCLEX exam as it stands today, and especially the development of the next generation NCLEX. First, we have NCSBN's role in protecting the public. At its core, the NCLEX is more than just a licensure exam. It's a public safety measure designed to ensure that every nurse entering the workforce can practice safely, competently, and ethically from day one. Second, we must consider the current healthcare environment. Nursing today looks very different from even 10 years ago. Patients are more complex, care is faster paced, and nurses are making high stakes decisions earlier in their careers. The exam had to evolve to reflect this reality. And finally, we're talking about the clinical judgment measurement model, which is the foundation for how clinical thinking is now evaluated on the NCLEX. It's a structured way to measure how nurses recognize, analyze, and respond to patient needs, especially in complex situations. One of NCSBN's most important responsibilities, and really the heart of its mission, is to protect the public. The NCLEX is designed to support client safety and improve outcomes. This isn't just about passing a test. It's about making sure that when a nurse walks into a patient's room, they're equipped to recognize risk, respond appropriately, and prevent harm. The exam is calibrated to assess the knowledge and skill set of prepared entry-level nurses. It's not meant to test specialists or experienced practitioners. It's focused on the core competencies that new graduates need to practice safely and independently. Strong decision-making skills are at the center of it all. Nurses today must make clinical judgments under pressure, often with incomplete data and time constraints. The NCLEX has evolved to reflect this reality by evaluating not just what a nurse knows, but how they apply the knowledge in the moment. So when we talk about protecting the public, we're really talking about this entire ecosystem, ensuring nurses can think critically, act safely, and ultimately deliver care that leads to better outcomes. As we think about how NCLEX has evolved, it's important to remember that it's not changing in a vacuum. It's changing in direct response to the realities of modern healthcare and some key shifts. The nursing role has become more complex than ever. Nurses are no longer just following orders or completing tasks. They're leading care coordination, managing patient transitions, and making high-stakes decisions in fast-paced environments. The NCLEX needs to assess whether a nurse can think like a nurse from the start. We're seeing higher acuity clients and more comorbidities across nearly every setting. Patients are living longer, but with more complex health challenges. Think diabetes, heart failure, COPD, and cognitive decline all in one person. Entry-level nurses must be able to triage, prioritize, and act quickly with confidence. We can't ignore the role of electronic health records. Nurses today need to do more than document. They need to interpret digital data, recognize changes in trends, and navigate charting systems efficiently. These skills are now woven into NCLEX style items to mirror practice. And finally, healthcare today is a team sport. Interprofessional collaboration is essential. Nurses have to communicate clearly with physicians, therapists, pharmacists, social workers. The NCLEX increasingly includes scenarios where nurses must advocate, clarify, or escalate care within a team-based model. So the changes to the exam aren't random, they're direct response to the changing demands of practice. One of the most important updates to the NCLEX, especially in the next-gen format, is its shift towards measuring clinical judgment and decision-making. Why is this so important? First, it directly supports practice readiness. New nurses need more than textbook knowledge. They need to apply that knowledge in unpredictable, high-pressure situations. Strong clinical decision-making skills help decrease delays, errors, and risk. Nurses are often the first to recognize early warning signs, whether it's a subtle change in vitals, a confused patient, or a critical lab value. Teaching and assessing these skills early reduces the chance that something important gets missed or that care is delayed. And finally, it all leads to safer care. That's the ultimate goal. When nurses can accurately assess a situation, anticipate complications, and act appropriately, patient outcomes will improve. Before we go any further, let's take a moment to ground ourselves in what we actually mean when we talk about clinical judgment. The National Council of State Boards of Nursing provides a clear and structured definition. Clinical judgment is the observed outcome of critical thinking and decision-making. It is an iterative process that uses nursing knowledge to observe and assess presenting situations, identify a prioritized client concern, and generate the best possible evidence-based solution in order to deliver safe client care. Clinical judgment is built around a comprehensive model to guide how we measure it in a consistent, meaningful way. This is the clinical judgment measurement model. It breaks down the process of clinical judgment into specific observable layers. The model doesn't help exam developers write questions. It also gives educators a roadmap for teaching and coaching students to think more like nurses. And for students, it's often a structured way to understand how they're expected to make decisions in practice. Now let's zoom in on layer 3 of the model. This is where the real decision-making happens. Level 3 represents the observable, measurable steps that a nurse takes when using clinical judgment in practice. It includes 6 steps: recognize cues, analyze cues, prioritize hypotheses, generate solutions, take actions, and evaluate outcomes. These steps are iterative and dynamic, meaning nurses often move back and forth between them as the situation evolves. This part of the model is especially important for item writing and assessment design because it gives us a concrete way to evaluate how students think, not just what they know. Level 4 helps us understand that clinical judgment doesn't happen in a vacuum. Every decision a nurse makes is influenced by both the environment they're working in and their own individual attributes. You'll notice on this model that the influences are divided into those 2 categories. The white bubbles represent the external influences, the conditions of the setting where care is delivered. These are things like the urgency of the situation, The resources available like equipment and time and staffing, any interruptions or distractions, and the culture of the workplace or the unit. These are things that can either support or challenge a nurse's ability to make sound judgments in the moment. The gray bubbles are the individual factors. They reflect the internal attributes a nurse brings to the situation. They include their knowledge and experience level, their emotional state, such as stress or confidence or fatigue, biases or assumptions, and personal values or priorities. Even highly skilled nurses can make different decisions based on what's happening internally or what they're bringing into the moment. As educators, understanding these influences help us create more realistic scenarios and also reminds us to prepare students not just for the test, but for the complexity of real-world practice. When we talk about what belongs on the NCLEX and what we should be preparing students for, we're not guessing. The NCSBN practice analysis is the foundation that guides every update to the test plan. This analysis is a comprehensive research effort conducted regularly by NCSBN. Its purpose is to determine exactly what activities newly licensed nurses are doing in their first year of practice and how often they're doing them. In other words, the focus isn't on what's nice to know, it's on what's necessary to do. The analysis zeroes in on three primary questions for each nursing task. How frequently is it performed? How important is it to patient safety and care? And most recently, how relevant is it to clinical judgment? So these three questions help determine what type of content, skills, and thinking should appear on the exam, and by extension, in our teaching and assessment practices. So when you're writing test questions or designing case studies or even creating lesson plans, this research is a valuable compass. It shows if something shows up on this practice analysis and it's frequent, important, and judgment driven, it should absolutely show up on our assessments. The NCSBN test plan is the blueprint that drives the structure of the NCLEX. It's created from the data from that practice analysis. It outlines exactly how content should be distributed across the exam. At the heart of the test plan are the client needs categories. These represent the key areas of nursing practice that every entry-level nurse must be prepared to address. Things like safety, health promotion, and physiological integrity. Each category is assigned a specific percentage of items on the test, and these percentages reflect how often the associated tasks occur in actual practice and how critical they are to client safety. So as educators, the test plan isn't just a reference, it's a roadmap. It helps ensure our content is balanced, relevant, and aligned with what new nurses really need to know and do. On the left, you'll see a table showing the major client needs categories, along with the percentage ranges of questions associated with each. On the right, you'll see a pie chart that visually breaks down this distribution. This visual helps reinforce why it's so important for us educators to prioritize our time and test items accordingly. Maslow's hierarchy of needs is a foundational framework to prioritize care. Maslow's model organizes human needs into 5 levels, starting from the most basic and essential for survival at the bottom to the higher level psychological and self-fulfillment needs at the top. In the context of nursing and item writing, this model helps us determine which patient needs takes precedence in a clinical scenario. Physiological needs, now these come first. They're breathing, circulation, food, water, elimination, and even temperature regulation. If these aren't met, nothing else matters. Safety needs, assessing for risk, infection control, fall prevention, medication safety, and emotional security. Love and belonging, esteem, self-actualization, these are important, but they come after physical survival and safety are secured. So when we're writing or analyzing test items, especially those involving prioritization, Maslow's framework is an essential guide and it helps us justify why one action or intervention is more urgent than another, even when both could be technically correct. Now, let's turn our attention to another foundational framework, which is Bloom's taxonomy. Bloom's is all about how we think and how we help students move from simply remembering information to being able to analyze, apply, and evaluate in real world settings. This taxonomy organizes cognitive processes into 6 hierarchical levels, which are especially useful for designing both learning objectives and test questions. Remember is that basic recall of facts and definitions. Understand is in explaining concepts or interpreting meaning. Apply is using knowledge in a new but unfamiliar situation. Analyze is breaking information down and recognizing patterns. Evaluate is making judgments or decisions based on criteria. And create is generating original ideas or solutions. When we write items or even classroom exams, it's essential to think beyond recall. For example, a question that asks, which action should the nurse take first, is functioning at that evaluate level because it requires students to weigh options and make a decision based on reasoning, not just memory. As we start to put all these frameworks into practice, the next natural question is, well, what actually makes a test item great? What turns a good question into one that truly challenges students and prepares them for real world decision making? Well, first, it aligns with learning objectives. Every item should directly connect to a skill or competency students are expected to master. If it doesn't have a clear instructional target, it probably doesn't belong on the test. Alignment assures that we're measuring what we've actually taught. It uses realistic, relevant scenarios. The best items feel like nursing. They place the student in the role of the nurse, facing a decision in clinical context. These decisions scenarios don't need to be dramatic, but they should be grounded in practice, like prioritizing care, interpreting vital signs, or evaluating interventions. They should test higher order thinking, and that's where the Blooms comes in. A great item goes beyond recall. It requires students to apply, analyze, and make judgments. These are the types of questions that not only reflect the NCLEX, but also prepare the students to critically think when it matters the most. And finally, it's fair and bias-free. Every student, regardless of their background, should have equal access to the item. And that means avoiding cultural references, stereotypes, or assumptions that could confuse or disadvantage learners. It also means writing in clear, neutral language that focuses on competence, not trivia. So when we begin to build our test items, these 4 principles serve as our checklist. If an item hits all 4, you're not just writing a question, you're building a valid, meaningful, and equitable assessment tool. Most NCLEX style questions, especially multiple choice or case-based questions, have 3 essential components. First, the scenario. This is the clinical context, the background information that sets the stage. It might include the patient's age, diagnosis, vital signs, or recent changes in condition. The goal here is to create that realistic situation that helps students visualize the client encounter and gather relevant cues. The scenario should feel like something a nurse could experience on any given shift. The STEM is the actual question being asked. It should be concise, clear, and focus on a single task. The best stems avoid negative phrasing like, which is not, and instead prompt action or decision making. And finally, the answer options. This includes the key, which is the one best answer, and distractors, which are plausible but incorrect choices, and more on distractors in a minute. Every great test item starts with one very important question. What do you need the student to know? The first step, choosing an objective, sets that entire tone and direction for your question. Without a clear objective, you're just writing in the dark. First, your objective should point to a specific knowledge area, task, skill, or concept that you want to assess. Second, make sure the objective is within the scope of the learner's level. When writing for pre-licensure students, not for experts, so keep it practical, realistic, and appropriate for their stage of learning. And third, your objective must be observable and measurable. If you can't clearly describe what success looks like, it will be nearly impossible to write a defensible question around it. So ask yourself, can I assess this with a scenario and a question that reflects real-world decision making? Once you've defined a strong measurable objective, you've built this foundation. Everything else, the scenario, the STEM, the answer options will flow from this step. It's how we ensure every item has intentionality and impact. The next step in writing a high-quality question is to build that scenario. First, choose a relevant setting and context, whether it's the med-surg floor, the emergency department, a pediatric clinic, or a long-term care facility. Your scenario should mirror places where entry-level nurses are expected to practice. Your scenario should involve both a client and a nurse. The client provides the clinical cues, the nurse is the decision maker. This relationship sets that stage for that clinical reasoning, action, and response. And avoid rare or overly complex conditions. You don't need to use obscure diseases to make a question challenging. Instead, focus on everyday situations that require prioritization, safety awareness, or interpretation of changes in a condition. For example, a client recovering from abdominal surgery who suddenly becomes restless and tachycardic, well, that's enough to generate meaningful decisions. And finally, include only the essential information to inform the decision. This is not a teaching moment. Avoid explaining the condition or walking the student to the right answer. The scenario should provide enough context for the student to make a safe, evidence-based choice on their own. The next step is to write the STEM, that actual question the student will answer. The STEM should be a single, clear, direct question. Avoid combining multiple questions into one and keep it focused on a single decision or judgment the student needs to make. The goal is to prompt thoughtful reasoning, not to confuse or to overload. And make sure your STEM is not tricky or vague. Avoid unnecessarily complex or wording that can cause misinterpretation. The NCLEX isn't designed to trick students. It's meant to assess their readiness. And finally, use common and consistent formats. These are familiar to students and allow them to focus on the clinical thinking, not on interpreting the question. Some of the most effective STEMs include: which action should the nurse take first, which is the best response, and which client warrants immediate attention. The last step is writing the answer options, arguably one of the trickiest part of item writing. But here's some suggestions to do it effectively. First, include one key, the correct response, and 3 to 4 plausible distractors. The distractors should be clinically reasonable, not obviously wrong or silly. They should reflect common errors in thinking or real misconceptions that students might have. The best distractors challenge students to analyze and discriminate, not guess. Avoid absolutes like all or always or every. These terms are rarely accurate in healthcare, and students are often trained to view them as red flags. Unless it's absolutely evidence-based and unequivocal, still steer clear of absolute language. It can skew item performance. Keep answer choices homogeneous in grammar, length, and format. This is the key to avoiding unintentional clues. If your correct answer is longer, more detailed, or uses different terminology than the distractors, Students may pick it just because it sounds better, so keep everything consistent. And finally, avoid direct opposites in your choices. For example, if you include increase IV fluids and decrease IV fluids as two options, you're forcing students to focus on language structure, not clinical reasoning. Instead, offer options that require thoughtful analysis on what's best, not just what's on wrong. Strong answer options elevate the quality of your item and increase its reliability. Now I'm going to turn it to Dawn to discuss other question types.
Thank you, Christy. Now we'll go into the various question types from single answer, multiple choice, the SATA, select in, discuss close and give some examples, matrix, and then even talk about some case study questions moving forward. So there are 4 multiple response types items: multiple response SATA, or select all that apply, multiple response select in, multiple response grouping, and multiple response matrix. This is an example of a select all that apply. And what you'll see here is there can be one or more correct responses in this particular example and in all SATAs. And there will also be, could be at least 5 options, but no more than 9. And all options could be correct, or it could be just one correct answer. This is an example of a multiple response select in. It allows candidates to select one or more options, but it tells the candidate how many in, for instance, that can be selected. This particular example shows which 4 physician orders does the nurse anticipate. Our next example is a hotspot. There can be some hotspot questions provided within the platform as well. And this is an example of a diagram, and the student has directions within the stem to make a selection based on where the tail of Spence is. So they'll click using their cursor of where the tail of Spence is. Next, we have a fill in the blank or a close question. So there are 3 different types. There's drop down close, drop down rationale, and drop down tables. We'll look at a few of these. When you see the word close, it indicates that the students are going to be completing a sentence or completing a paragraph. So this is one of those examples. When you see the word rationale, it implies cause and effect. So this particular one is a closed fill in the blank item. So they'll just make their selections by selecting the drop down to complete the sentence. Our next item is a drop down close also. And here you'll see that there's, again, they're filling in the sentence and selecting the best response based on the options that they have as they select. Drag and drop questions. Here's an item that shows an example that these particular items will have a minimum of 4 and a maximum of 10 selections. There can be more response targets to which to drag a selection. There's a minimum of 1 sentence with 1 target and a maximum of 5 sentences with 1 target per sentence. Next, we have a matrix example, and I'm giving 2 different examples. It's a matrix multiple choice to the left, and to the right is a matrix multiple response. The matrix multiple choice, each row must have 1 response option selected, and it gives those details with the arrow. You'll see that there's some instructions that the student must follow there below where the arrow is pointing. With a matrix multiple response, each column must have at least 1 response option. A row can possibly have no responses, but they can select options within each row. And again, it's very important to follow follow the instructions that are listed next to the note. The next example is an example of a highlight. There are two different types of highlight items. They're the highlight text and the highlight table. The highlight text will include a paragraph or information, and the candidate will select parts of the text based on what the question is asking. There can be a maximum of 10 options, and the candidate can deselect text also by clicking on it again. The highlight table is another option that the potential selection of questions that they may see, and it also can include information within the table in a table format, and the candidate will select parts of the text based on what the question is asking. The next item you're seeing here is a bow tie, and we're calling it a standalone. It's a standalone item because it can address more than one. It actually evaluates all the cognitive skills of the clinical judgment measurement model within one test question. Visually, it's called a bow tie because it looks like a bow tie. You have the scenario over on the left-hand side and then the stem of the question. There are 5 options on the right and the left and 4 options in the middle. Faculty have reported this is one of the most enjoyable items to write because it is assessing all levels of the cognitive skills within the clinical judgment measurement model. We guide students to complete the middle section first, then go from left to right. The next item we have is a trend item or another standalone. It addresses more than one step of the clinical judgment measurement model by requiring the review of data over time. So they're following trends. There can be nursing notes, vital signs, lab work, etc., that they have the tabs to review, and it can measure any feature or any type of item within this particular trend item. I'll turn it back over to Christi.
Thank you, Dawn. Now let's shift our focus to one of the most impactful components of the modern NCLEX style assessment, which is that case study. Case studies are at the heart of the next-gen NCLEX and are essential for capturing that depth and complexity of clinical judgment. Before we start building our own case study, I want to introduce a powerful tool that can guide the writing process, the NCSBN Best Practice Template for developing test items. This template helps item writers stay focused on specific layers of the model, write questions with a clear purpose, and ensure that items align with how clinical decisions are made in practice. Here's what the completed best practice template looks like in action. This completed template becomes your blueprint. It ensures your scenario, question type, and correct answer are all working towards the same goal. We begin writing a case study with the first cognitive process, recognize cues. This step is all about noticing and gathering relevant information, the kind of information a nurse would pick up from multiple sources during an actual patient encounter. Cues come in many forms, and the nurse's first job is to decide what's important here, what do I need to pay attention to, and what can I filter out. Some examples of cue sources include vital signs. Are there any abnormalities or trends over time? Observed clinical signs. What do I physically see? Respiratory distress, skin changes, bleeding. Client descriptions. What is the patient telling you? Are they describing pain or dizziness or confusion? And observations by family. Sometimes subtle changes are first noticed by someone who knows the client best. Did a family member say, she's not acting like herself? The next step is to analyze cues. At this stage, we begin to make sense of the data we've collected. It's about connecting the dots and figuring out what the cues might mean. There are 2 questions that we ask here. What condition supports the recognized cues? This is where pattern recognition begins. The nurse must begin forming a clinical picture. Do these cues suggest pain, hypoxia, dehydration, a post-op complication? We're not diagnosing, but we're thinking critically about what could be going on. And what else do I need to determine the significance of a recognized cue? Sometimes a cue is only meaningful in the context of something else. A respiratory rate of 22 might not be alarming on its own, but when paired with low oxygen saturation or labored breathing, it becomes more significant. Next, we move to prioritizing hypotheses. This is the step where the nurse begins to form possible explanations for what's going on and decide what needs the most immediate attention. Key questions here are, what are possible explanations for the cues? Based on the data we've reviewed, we've considered all the potential causes. For example, is the client's shortness of breath due to fluid overload, anxiety, or a pulmonary embolism? What is most likely? This is where probability comes in. Of all the possibilities, which condition or complication is most consistent with the cues? This helps the nurse focus and avoid chasing low probability scenarios that don't match the picture. What is most urgent? This is often the most critical decision. Even if something is less likely, if it's life-threatening, it may need to be addressed first. And this is the moment where clinical judgment meets prioritization. In practice, this step reflects what nurses do constantly, assessing the situation, weighing risk, and deciding where to act first. It's not about choosing from a list of right and wrong. It's about identifying what matters most right now. The next step is to generate solutions. This is the action planning phase where the nurse determines what to do in response to the situation. Key questions that guide us in writing this step is, what outcome do I want the client to achieve? Everything we do in nursing is outcome driven. Are we trying to stabilize blood pressure, reduce pain, prevent a complication? Clarifying that goal first helps ensure our actions are intentional and targeted. What interventions will help me achieve that outcome? This is where we choose among possible nursing actions. Should we raise the head of the bed, notify the provider, administer a medication? These aren't random tasks. They're chosen specifically to move the client toward the desired outcome. And do I need more information? Sometimes we realize we're not ready to act yet. Maybe we need a blood sugar level, a lab result, or input from another team member. In clinical judgment, pausing to gather missing data can be the right action. And this question reminds us to consider that. Take action. This is the moment when planning becomes doing. It's where judgment turns into nursing practice and the client begins to benefit from the nurse's decision. There are two central questions in this step. Which intervention is most appropriate? The nurse must choose the intervention that best aligns with the client's current needs, priorities, and safety. This may be something like administering a medication, initiating fall precautions, repositioning the client, or notifying the provider. Not every action is urgent or correct. Even some helpful ones might not be appropriate in this moment. And that's what makes this step so critical. How do I implement that intervention? It's not just what you do, it's how you do it. Does the nurse need to gather supplies, explain the procedures, or monitor the client afterwards? Now, the final step is evaluate outcomes. This is the part where the nurse looks back on the action taken and asks, did it work? There are three questions that guide us in writing this step. Did my intervention work? This is the heart of outcome evaluation. Does the client's condition improve? Was the goal achieved? Nurses must determine whether the intervention had the intended effect or if something needs to change. How do I know? This question emphasizes the importance of that data. Is the client's pain reduced? Is their blood pressure stabilized? Did that bleeding stop? Nurses evaluate outcomes by reassessing, comparing results to expected norms, and using their critical eye to confirm improvement or flag ongoing concerns. Would something else have been better? And this brings in that reflection and adaptability side of nursing. Maybe the intervention helped, but not enough. Maybe something less invasive could have been just as effective. This is how nurses grow from each clinical experience, each decision, each outcome. Well, we've now walked through all steps of the case study. For us as educators, using the 6 steps of the clinical judgment measurement model give us a powerful blueprint. It helps us design case studies that mirror clinical reality, write questions that go beyond recall, build assessments that develop and test true clinical judgment. As we wrap up our conversation, there's one final step I want to emphasize, and that's peer review. Even the most experienced item writers benefit from having a second set of eyes. And here are some key areas your peer review should focus on. Alignment and purpose. Is the item clearly tied to a learning objective or competency? Does it match the cognitive level and the clinical judgment measurement model step you intended to assess? Clinical accuracy. Are all the facts right? Does the intervention reflect current evidence-based practice? Is there any outdated terminology or misleading phrasing? Clarity and readability. Is the language clear, direct, and free from ambiguity? Could this item be misread or misinterpreted? Quality of answer options. Are the distractors plausible but clearly incorrect? Are the options grammatically and structurally parallel? Bias and inclusivity. Does the item avoid stereotypes or cultural assumptions? Is the client scenario inclusive and respectful? Rationale and source. Is there documentation to support the correct answer? Have you included a brief rationale or reference for reviewers? Now, taking the time for peer review isn't just about polishing grammar. It's about ensuring that your items are fair, defensible, and clinically appropriate. It's one of the most important things we can do to support both learner success and patient safety. So before your question goes into a test bank or book, have someone else look at it. You'll always come away with something that makes it stronger. Now I'm going to quickly show you a sample developed by the Kaplan Nursing content team. This is just one of the many case studies we provide, each designed to reflect the clinical judgment model and to help learners build confidence with NCLEX style thinking. Now, if I go too fast, don't worry. Our nurse educator consultants like Dawn can give you information on how to review the question on Kaplan's platform. Step 1, recognize cues, a highlight question, and select the findings question. Step 2, a matrix question, asking the learner to analyze the cues. Additional information is provided. Then the learner must prioritize the hypothesis, answering what is the most risk and why. Now, question 4, to generate the solutions. Which nursing intervention is indicated or not indicated? In this case, the nurse is teaching, and the question is a select all that apply. The case study continues to unfold, and the learner is asked to take action. Finally, evaluation of outcomes. In this case, was the discharge teaching effective or ineffective? As you've seen through the sample and throughout our presentation today, creating strong NCLEX style questions and case studies take more than just clinical knowledge. It takes intention, structure, and a deep understanding of how nurses think and practice. Whether you're writing for classroom assessments, preparing students for licensure, or contributing to large-scale test development, the clinical judgment measurement model gives us a clear, practical framework to follow. If you remember just a few things from today, let them be these. Start with a clear learning objective, build a scenario that feels real, align each question to a specific thinking step, and always peer review your work. Thank you for your time.